Hi, everybody. My name is Eric Carter, and I'm a professor at Macalester College. I'm in the geography department here, and I'm also affiliated with our Latin American Studies program. And I'm also the director of the Community and Global Health Concentration, or CGH. And actually, I just wanted to take a couple minutes and tell you a little bit about the CGH concentration. CGH is one of the oldest and largest concentrations on campus. We currently have about 60 students and about 10 faculty who are affiliated with the program. And there's a really strong community that comes together at many social events and academic events throughout the year. In CGH, what we do is help students understand the complex nature of public health problems and try to provide you with the critical analytical tools you need to engage public health policy at different scales, from the community to your state to the national level and internationally. And we feel that this concentration has been relevant for a very long time, but it's especially relevant now with everything that's happening with the coronavirus pandemic. This is not a pre-med curriculum, although we also have that here on campus. But we approach health issues mainly from an interdisciplinary focus that bridges the social sciences, humanities, and the natural sciences. So students in CGH might take courses like my class, medical geography, medical anthropology, health economics is also really important. We have psychology courses, philosophy courses like bioethics, epidemiology is a cornerstone of the CGH concentration. And we have about 15 to 20 courses every semester that count for this concentration. And aside from the coursework, another really important part of CGH is the community engagement aspect. So all of our concentrators, as part of the requirements, complete an internship or some sort of advanced research project in affiliation with an organization that works in public health. So just in the last few years, our students have done internships at places like local clinics, Planned Parenthood, the Minnesota AIDS Center, or as part of their study away experiences in Senegal, France, Denmark, Ecuador, Chile, just to name a few examples. We've actually had a lot of students, usually 2 or 3 every semester, who work as interns at the Minnesota Department of Health, which is one of the country's best public health, state-run public health programs. And that's an incredible opportunity for our students to gain real-world experience. In fact, some of our current students working at the Minnesota Department of Health are going to be transferred from what they usually work on to working on some of the coronavirus epidemic response. Over the last 10 years or 11 years that this concentration has been in existence, we have about 300 alumni all over the world, and many of them have gone on to careers in public health at places like the World Health Organization, the Institute for Health Metrics and Evaluation, which is in Seattle, the Mayo Clinic, and in fact, one of our recent alums works for the King County, Washington Health Department in Seattle, and she's on the front lines right now fighting the coronavirus epidemic there. So it's just a great concentration. It's always really relevant to current events, and it really is one of the programs here where you can really gain some real world experience that is really well integrated with your liberal arts coursework. So if you have any questions about the concentration, please feel free to email me directly. I'm the director, and I love to field any questions that you might have. And I can always give you more information via email, or we could even chat online. So thanks very much.